Today, I'm going to guide you through a life-saving technique, Cardiopulmonary Resuscitation, or CPR. CPR is a life-saving technique used in emergencies when a person's heart stops beating or they stop breathing. It is essential to maintain blood circulation and oxygen supply to the brain and other vital organs until professional medical help arrives or spontaneous circulation is restored. Performing CPR promptly can double or even triple a person's chance of survival. So, let's dive into the steps you need to remember. First off, CPR follows the KB approach: compressions, airway, breathing. Let's start with compressions. Begin with chest compressions to restore blood circulation. Place the heel of one hand in the center of the chest, with your other hand on top. Push hard and fast at a depth of about 2 inches for adults, aiming for 100 to 120 compressions per minute. Make sure to let the chest fully recoil between compressions. Next is airway. After 30 compressions, check the airway. Use the head tilt chin lift maneuver or jaw thrust maneuver to open the airway unless you suspect a neck or spinal injury. Now, breathing. Give 2 rescue breaths after every 30 compressions. Pinch the person's nose, cover their mouth with yours, and give 2 slow breaths, ensuring the chest rises. If an automated external defibrillator, AED, is available, use it immediately. Turn it on, attach the pads, and follow the voice prompts. Ensure no one is touching the patient when delivering a shock. Continue CPR until professional help arrives or the patient shows signs of life. CPR is essential when someone is unresponsive and not breathing or only gasping. Shake or tap them and shout, "Are you okay?" If there's no response and no breathing, begin CPR immediately. High-quality compressions are key. Ensure correct depth and rate, and avoid interruptions. Rescue breaths are crucial in cases like drowning or drug overdose to ensure oxygen delivery to the lungs. If you're not trained in giving breaths, perform hands-only CPR, continuous chest compressions without rescue breaths. For infants and children, CPR is slightly different. Use 2 fingers for infants and 1 or 2 hands for children, compressing about 1.5 inches for infants and 2 inches for children. The compression-to-breath ratio is 30 versus 2 for single rescuers and 15 versus 2 for 2 rescuers. The primary goal of CPR is to maintain the perfusion of critical organs, especially the brain, until spontaneous circulation can be restored, either through medical intervention or advanced life support. Cardiopulmonary cerebral resuscitation, CPCR, is an advanced form of CPR, with a greater emphasis on maintaining not just heart and lung function, but also preserving brain function during resuscitation efforts. CPCR adds an emphasis on preserving brain function by ensuring adequate cerebral perfusion during resuscitation. Remember, the chain of survival includes early recognition and calling for help, early CPR, rapid defibrillation, advanced life support, and post-cardiac arrest care. Time to initiation of resuscitation efforts is critical for survival and neurological outcomes. Immediate recognition and initiation of CPR can significantly improve the chances of recovery. Though CPR can cause rib fractures or lung injuries, the risks of not performing CPR far outweigh these potential complications. Stay safe and be prepared. You have the power to save lives with CPR. In essence, CPR is a critical life-saving intervention that can significantly improve the chances of survival following cardiac arrest. Quick action, proper technique, and, if available, the use of an AED are essential to its success. Regular CPR training and understanding its steps and principles are key to effective emergency response.